Central Amphitheater 1, here in Cebu City. It's the Tonight Show starring Krissha. And now, here she is, Krissha. Good evening, everyone, and we are down to the final part of our show. And with that, it is time to kick up the first ever Tonight's Show Film Festival. Let's watch this.
Internship is the highlight of medical school. Everything that we've been preparing for the past 3 years all boils down to this very moment. But not everything is as easy as it seems. Aside from dealing with your group mates and paperwork, you also have to deal with your patients. Each patient is like a fingerprint. They are never really the same. Some of them will be easy and some will be difficult. They will test you and you've got to be strong, compassionate, and professional. So you should know how to deal with your patients. And this is where bioethics comes in.
Wow, I'm so excited for this one. Well, we collaborated with a bunch of junior clerks all the way from the Cebu Institute of Medicine and interviewed some senior clerks, PGIs, and residents from CBGH to let us know more about how they were able to apply bioethics in their practice. Let's take a look at this.
Recently lang, I had this cancer patient. Keeping in touch with the family, they decided to order a DNR. They don't want to see their mother suffer more.
I know this is hard for you, but judging on the patient's state, we can still save her.
No, don't worry about it forever longer. I'm pretty sure she wouldn't want to continue suffering too, though. We already know her prognosis, so I think it's better for everyone, also for her. But we let her go now.
I've always had a hard time or a dilemma in cases where the patient can still be saved pero ang family ordered a DNR or an A&D. As a physician, it is always our job to try and do our best to save the life of the patient. But at the same time, naay limits to what we can and cannot do, and we must respect the wishes of the family of the patient. In my experience po, we had a case of teenage pregnancy. It was a high-risk pregnancy, so she needed to be regularly followed up. Patient decided otherwise, and we respected her final decision. We apply the principle of autonomy here.
Since our patient is pregnant at this young age and is considered high risk, she needs to have her labs and prenatal checkups. It's also important in order to prevent any complications for her and for her baby, and the money we raise is enough to cover the expenses.
You might have a problem though, since the patient consented at first but then refused to have her labs taken after.
But we have to convince the patient it's for her own good. Ma'am, I know that this is hard for you to process as of the moment, but I am here to guide you and help you. And considering that you're only 19 years old and 5 months pregnant, this places you at a high risk of acquiring complications. That's why we made a management plan for you to undergo frequent prenatal checkups, get your labs done, and take the right medication too.
Tagpila man sa magpakonsulta, Dok. Tagpila man ang kuan, Dok, kanang medical exam. Kanang mga medisina, Dok, tagpila di na.
You don't have to worry about the expenses, ma'am, because we are going to help raise funds for your routine checkups and medicines.
Di naman siguro ni kinahanglan magpa sana, Dok, lab-lab or kanang prenatal check-up, Dok. Nakaduwag naman as mga bayro nun, Dok, uy. Hadlok sad ko, Dok, kay sa akong sitwasyon nun ba, kay di ko kabaw kung sa'yo may tabo. Sa ako, sa akong gidala nga bata.
Ma'am, I know this is hard for you to process as of now, but I think we should follow the management plan in order for us to monitor the condition of you and your baby and to ensure the safety of you and your baby as well.
Sorry kayo, Dok, ha. Salamat kasi yung mga tabang, Dok, pero dili lang sa jud po ko, Dok.
It was so frustrating for us when the patient at first accepted our help, but as the pregnancy went along, the patient was more reluctant to adhere to the required follow-ups. Even when we told the patient that we would finance all the follow-ups and needed medications, she would still feel scared because of the cost of the whole pregnancy. Ako pod, I also felt so helpless, as there was nothing we can do to force the patient for her needed prenatal checkups. But based on what I've learned from bioethics, I have an obligation to respect the autonomy of the patient. That is to respect their decisions concerning their own lives.
We had this experience as a group. During our COVID-19 hotline duty, we take our patient's history, and of course, this would include sensitive topics as well. One time, we had this patient in one of our teleconsultation sessions who complained of a penile discharge.
Mayong buntag, Dok. Naanta ko'y ipakonsulta sa imo ron, Dok. Kanang nakabantay ko, Dok, ba? Tawd na pud mi nga nang katul akong ari ba, then nakabantay pud ko mga duga kanang discharges by tawagan ni Dok. Ug napog mga burot nga mga gagmay. Ano man ni siya, Dok? Unsay pwede matambal na ko ani?
Sige sir, kay dili man ti ka ma-examine sa personal jud sir. Okay ra nimo if magpadala nako sir para ma-document nako kung unsa jud ang imong gireklamo para pud masusi nato kung unsa jud siya.
Maulaw man ko, Dok. Dira ka makalat ako mga pictures ana, Dok.
Sir, dili ra ta mabala ka sir kay tanan natong gistoryaan karon sir apil ang mga detalye kay confidential ra jud na siya sir.
Saligra ko ng doktora.
Sige sir, na ako'y mga pangutana nimo sir ba nga medyo sensitibo. Okay ra nimo sir?
Sige, Dok. Okay ra, Dok.
Sige sir, kung okay ra sa imo sir, kaya magpadayon ko sir. So, kano sa imo pinakauna na pakighilawa sir?
I need to log in early to prepare for my case.
So, good morning everyone. I'm Senior Clerk Joan. Today I will be presenting my case. So we have GC, who is a 24-year-old male, unemployed Filipino Roman Catholic, who came in for the first time last March 15, 2021 due to penile discharge.
In the end, whatever platform we use, be it in the virtual or the actual physical patient interaction, we should always ensure our patient's privacy as professionals of this field. Placing great value into the physician-patient relationship will enable the patient to develop trust to their physician. In return, this will enable the physician to reach the correct diagnosis and provide the appropriate management. Looking back, every experience I had taught me a lot, especially in applying what I learned from bioethics into this internship.
In the light of COVID, there have been numerous trials of management to combat the disease. Last month, as I ventured into my very first COVID rotation, it was imperative that each step of treatment was explained as thoroughly as possible to the patient. Whenever a new antiviral regimen was added to the management, we would have to have a consent signed by the patient prior to initiation. Most patients would agree to treatment immediately. However, there are a few that are very apprehensive with treatment. They would question our consultants who've had years of experience with what they've read online.
Good afternoon, ma'am. How are you feeling today? Based on your current condition, we may need to add a new antiviral regimen to your medications, since your previous medications doesn't seem to be working anymore. But before that, I would just like to hand you over this consent form stating the use of this antiviral drug and the possible side effects that you may experience.
Doc, are you sure it's safe?
You should know that it has a few side effects. One of the side effects or problems is that you may experience hypersensitivity reaction and severe headache. Also, 5% of the people who tried the drug in previous research experienced nausea, vomiting, and abnormal liver function tests. But, however, I just like to reassure you, ma'am, that this drug has also proven beneficial in its effect in improving the condition of patients with COVID.
I've seen articles on the internet regarding new COVID medications, and there seems to be a lot of people who have experienced these side effects. I'm scared I might experience them.
Ma'am, I just like to reassure you again that prior to the administration of this drug, we will perform blood tests to make sure you do not have conditions that would prevent you from safety using this drug. And we will still continue to monitor your condition while you are under treatment. Do you have any other questions, ma'am? If none, then you can sign the consent form before starting the initiation. Good afternoon, ma'am. So, ma'am, I have got your RT-PCR result and you tested positive. So, here are the process you need to know, ma'am.
Doc, wala ko kasabot. Pwede ko pa-explain balik, Doc?
Okay, ma'am. I'll repeat it again, ha. So, mao ni siya mahitabo.
During these situations, we see how important informing the patient and keeping him in the loop with his treatment. It protects both the patient and the physician from legal implications that would have stemmed if we didn't have protocols left in place. We are medical students. A big role indeed, especially in this time of pandemic. Online learning in medical school also proves that we are also in the front lines. God knows that you and I are doing our best to learn. Are we expected to get acquainted with some clinical skills in the comfort of our own homes? Yes. Is it easy? Was it ever that easy? No.
But we all know it does not stop there. Learning these skills aren't enough to call ourselves medical professionals. Professional. A big word, isn't it? Being a professional does not mean pass the boards and get that license. It's bigger than that. You need to have the heart and the right principles to be one.
Right. The past Thursdays we spent reflecting and grasping what bioethics really is. How we apply it in the future are our eye-openers. So far, what have we learned? To sum it up, the principles of autonomy, justice, beneficence, and non-maleficence. By definition, we know what these are, but we must apply them too. We must ask ourselves these questions. What is the right thing to do? What are our obligations to one another? What is the appropriate response to this moral dilemma? What does it mean to be a good doctor? What does it mean to be a physician with a heart?
And when you know the answers to those questions, you can find yourself communicating clearly to your patients, promoting patient safety, and most of all, make an ethical decision guided by moral principles. I remember scrolling through the pages of this article in the Journal of Medical Ethics. It states that, I quote, "We in the medical field must remember what it feels like to be on the other end of the stethoscope." End quote. The author also emphasized the words by a former New York Times critic. He said that, "To most physicians, my illness is a routine incident in their rounds, while for me, it's the crisis of my life. I would feel better if I had a doctor who at least perceived this incongruity." These words must hold a big impact on our purpose, why we want to be physicians.
As future doctors, it is more than living a comfortable life. We must focus on a patient-centered approach and apply what is morally right. We must be patient advocates, We must understand the vulnerability of the patient and make an effort to enable the patient's decision making to his health situation and recovery. We need to emphasize that it is a must to include bioethics in our daily practice as medical students and soon as physicians.
You don't need to think twice whether you should act ethically. It is a must. It is a necessity. It isn't enough to define bioethics and enumerate the principles. We must do the things we know are right. So stop the talk and just act.
Well, I definitely learned a lot from those interviews, and I'm sure you did too, right? Guess that's all for tonight. Thank you for watching. Stay safe and good night.